not, I'm doing the preparation, I'm helping my husband business in PWTC. We are running a budget hotel. So, you know lah, the Filipino wife is very concerned about whatever, you give us much money or no money, but we're still working hard. You know, because we are so devoted to our husband. Even our husband is another woman outside, but we just don't care. Right? Yeah, I've been through, my father is a politician, my husband is a politician. I tell you, it's not easy to handle. You know, my mother-in-law is a very famous here in Sabah. My father-in-law is a young family, is a very famous. The whole travel agent in Api-Api is belong to my father-in-law. So it's very difficult to handle. I'm also been here in 1991, but I go on. I'm sorry. Is I've been through all the life very difficulties before I met my husband. But when I met him, I don't know who know me here when 20. suctioning is, as I say, removing the obstruction, the secretion from this one airway to then to help for good ventilation, and also sometimes we obtain secretion for diagnostic purpose and to prevent infection that may result on the circulation when we are not proper suctioning. We let the secretion all the mouth for one very dirty long term. You never do a proper oral care, then it will end up with an infection. So suctioning is helping to prevent all this. Sign and symptom of requesting suctioning. When the patient has a sign of respiration distress, that means the patient turns to blue, unable to cough, and then the patient oxygen level is low, unable to cough out of the circulation, bubbling, you can see the bubbling of the mouth there, or else you can see patient very rapidly got the sound, and then you need the suctioning, obviously already. The patient having poor skin, cyanosis, poor skin color, that means something blocking the airway already. Decreased oxygen level. When just now we talk about oxygen, right? So it is a part of the why you need to check why the oxygen level is low. Whenever even you put oxygen already, why the oxygen is still low? Is it the circulation that blocking the airway? Then you need to put suctioning in. And then you can turn out the green sound there, you can rock and sound there, you can do the suctioning already. Patient turn to restless already. Why patient turn to restless? Because not enough oxygen already. She rather scramble for oxygen, all these things, so the problem is there. Then you need to do the suctioning. But remember in the mind, too frequent suctioning also not good. It will you will injure the patients if you do too frequent suctioning, you will notice when the thing will secrete out, it's like got blood already. Because too frequent suction also not good. Some of the patient family, they will ask you, suck my mother every 2 hours, 3 hours. They scared the mother block, airway blocking cannot got enough oxygen They will give you 2 hours suctioning, 3 hours suctioning. But you will have to tell them, too frequent suctioning, it will injure the patients. You only do suctioning when you think it's necessary only. Some patients, family, they didn't have enough knowledge. They're thinking that do suctioning is best.
For the aspirate test, actually you definitely need to do at least one test before you feed. So normally we will either do the bubbling or the aspirate. Alright. Another reason why we do the aspirate test is because in case the patient is having indigestion, the milk is not digested, the milk from the previous feeding is not digested. So when you aspirate, the milk will come out. Then you need to inform the patient is having indigestion. Don't feed some more. Imagine, the stomach is like a bucket. Now it's full with non-digested milk. Then you pour in some more milk. What will happen? It will overflow. It will come out to the throat, it will go into the lungs. Alright? And please always remember to prop up the patient. Patients with NG tube, even if you prop up and feed, there is still a risk of aspiration. Imagine if you don't prop up, the risk of aspiration is very high. Alright? So today, I think NG is covering topics that are a bit more technical, a bit more difficult, so that you can be prepared to care for patients that are more severe condition. Alright? So please really pay attention, because these are all details that if you do not follow or if you do not pay attention to, you may make a mistake and create problem. Alright? Okay, pass time over.
I forgot something to share with you all. Some of my junior even caregiver, they are confusing. When they aspirate, the milk come out, they will kill it, whether to push back or to discuss it. The undigested one. Because like Kathleen just now shared, when it's already patient undigested, you keep aspirating, it's getting come out 50, 30. Like sometimes you feel 200, it come out half. So whether
aspirated want to go back to the patient or not? No, it shouldn't. But because I notice some of them, they push back. They say not wasted because the medicine is there, the whatever is there, they will push back. I will tell you not to push back, but you will notice when you aspirate the first time, when you aspirate until the full syringe there already, it's still very easy to aspirate. That means you already notice, actually it might be second time you aspirate still can have. So actually either if the 6 o'clock you given the medicine to the patients, okay, it's 9 o'clock due the feeding, whether the milk you want to discuss it or want to push back. Want to discuss or want to push back. 6 o'clock you're given the medicine. 9 o'clock you notice when you aspirate there's a lot. Then it's not the milk color, it's a medicine color. So that means actually the medicine is actually not fully digested yet. It is, after you warm it up, you will swallow back or not? No, it's a common sense. It's a normal people. You just treat them as normal people. The aspiration thing is the thing you swallow. Aspiration thing, the thing that digested food is come out means there is something that you usually warm it out. Okay, you should not, push back to the patient. You can make the decisions because some family they will concern whether the medicine is already digested to the patient already or not. They might be concerned because for me, if I know that when 6 o'clock I give them the medicine, when I try to aspirate a bit, then I feel like it's going to have more coming out, I will not aspirate anymore. Then I will let patient, I will try again another 1 hour, 2 hour, aspirate and see. Until the patient fully digests already, I can't aspirate anything already, then I only continue the feeding for the next feeding. I will aspirate to a family. I'm not going to feed the 9 o'clock feeding because the patient still undigested yet. Still got the milk there. So I postpone the feeding to, I will tell them I will tell about 10:30, 10 o'clock, or 11 o'clock. Let the food to digest, the medicine to digest first. Then if there is keep undigested, you feed 11 o'clock already, then after travel it's still undigested. Then you need to inform the family. The timing has been changed, or the milk concentrations, the milk scope, the milk instead of 200, whether we want to reducing or not. You need to discuss with the family already. You do not make your own decision, all these things. Let the family to decide. Okay? This is the thing I want to share because I have come out few of the clients on what is oxygen. Oxygen is a gas. Okay? We found in the air that we now breathe in now. Okay? Necessarily, it's very necessary for us. We are grabbing the gas now. Okay? Some people with breathing disorder cannot get enough oxygen naturally, and it may need supplement oxygen or the oxygen therapy to improve the energy level and also the sleep pattern and improving the quality of life. Oxygen is a gas. Okay, oxygen is a gas. Oxygenation is a delivery of the gas to the body, tissue and cell to carry to all of our body. Our body needs oxygen to survive. So what is the cause for them not enough oxygen? What is the cause? When patient having fit, okay, seizure, when patient facing this sleep disorder, dyspnea, drug overdose, hypoventilations, lung problem, respiration distress is a lung problem, something like lung problem, it's one kind of the lung disease. Hanging, when you hang yourself, okay, and then also drowning, when you already go someone to see you jump down to the sea, you drowning, okay. Anemia, when you're not enough blood, your blood not enough blood, Okay, oxygen go into the blood and then the blood to help to carry the oxygen. So when you are having anemia, not enough the hemoglobin, then you will find that difficulty in breathing, poisoning. This is some of the sample that is causing that cause the oxygen, not enough oxygen. Okay. So when is the oxygen needed? When you need to give oxygen to the patient? When patient having rapid breathing, you have to detect. This is maybe one of the symptoms, but you need further details. When patient having shortness of breath, the very good identified for you all is when you all check the oxygen situation. You know how to check the oxygen situation? They have an equipment put on the finger. When you check it, then you will notice when it's in how many percent you need to put on the oxygen. 100% is perfect. Even though now you check me, you will get me 99 only. Very rare you can get a person with 100%. When in 90% or 90%, below 90%, it depends. 90% is depend. For the patient will have a lung fibrosis, lung disease, it might be 90% is actually enough for them already. You need to, after you check, if you check, notice that 90%, you have to check the patient physical condition also. Whether the patient is comfortable or not. Because some of the patients, when they have a used to the lung, they have lung problem for many years, asthma many years already. Sometimes when 90, 91, 92, they are comfortable. But for you and me, maybe we are feel a bit like already getting the gas ready, certain people. So you need to assess also the patient physically first. Okay? But of course, if it's lower than 90%, you need to put the oxygen. So patient coughing, sneezing. When the patient is already 90%, they keep coughing, and wheezing, heard the sound, something like that. Okay? Then you need oxygen. When the patient become pale, the colors of the skin change already. The lip already turn blue color already, or white already. The face become white already, pale already. Yes, you need to put oxygen. Fast heart rate, increased blood pressure is one of the symptoms for you all to alert also, whether to put in oxygen or not. So what is the oxygen device we have in the medically? At the patient house, you will see the first, cannot see clearly, okay? One is putting to the nose, one, the nasal prong, we call it, one mask. One is the mask you can see with the back. That one is already very ear already. I can consider what ear already when did it. Okay, the down one actually is for the patient with lung problems. Have to control the percentage of the oxygen to go into the patient. So the nasal prong actually is what is nasal prong is the device, one of the device can deliver the oxygen to the patient. They have consist of tubing with the two prong like this. Okay, you can see this side. The prong is followed by the curve of the nose. When you see the nasal prong, actually you will notice the prong is like curve like this. Okay, the shape is like this. So you put on the patient, okay, like this. Patient will be inspire air mixed with the room air. The oxygen through this device can deliver how many percentage room air to the patient? It's about 24 to 40% oxygen to the patient. In this type of nasal prong, you can put the oxygen from 1 to 5 liter only, but not more than 5 liter. Why? It's because it will causing a pressure, it carry a very high pressure to the patient, and it might cause the nose with dryness. Okay, and then this is a mucosa irritation. The disadvantage you can see. This device it only can provide 1 to 5 liter oxygen is because it cannot provide too high, more than 5 liter cannot already. It will carry very high pressure, it will harm to the patients. It will cause a patient having bleeding in future maybe. The advantage for this one, for patient, actually patient is more comfortable, he can talk when they want to eat and drink, they don't need to remove the mask, all these things is comfortable for them. It's quite cheap also actually. Face mask is the ones that will cover the face. This one is made with a silicone rubber, transparent plastic you can see, designed to fit the face automatically. It covers the nose and the mouth. Then on top there you can see you can adjust and fit this one the nose there. Okay, the flexible method is that you can adjust and fix the nose. Okay, the ventilation, this oxygen it can go to 10 liter. It means you can give to the patient from 6 liter oxygen to 10 liter oxygen. It will carry more oxygen to the patient. It can carry 40 to 60% oxygen to the patient. Okay. Then this device is got a bit of advantage and disadvantage also. What is the advantage is it's lightweight. It can able to provide more oxygen to the patient. The disadvantage I can say also the dryness and irritation of the eye because the nose bridge there. Okay, you will feel uncomfortable between the bridge there. And also, patient when want to eat is very uncomfortable, have to take out the mask, eat, then goes back. Okay, and then the surrounding of the face dryness. Okay, and some patients might be scared of that because it's covered the face, all these things, they will be scared. Okay. The other thing is the high flow mask that comes to very quite ill patients they will use it daily. We have 2 types, but just for you to familiar it only, not for you to sharing. Okay, because for medically we have 2 types of the high flow mask. We call it. You only need to understand this high flow mask is a mask carry a bag. That's what we call high flow mask. This high flow mask you can give 10 to 15 liter oxygen to the patient. It only differentiate, you can see rebreathing mask and non-rebreathing mask. It actually got one is called valve, one is no valve. Between the mask and valve or no valve only. The carry of percentage is about 60 to 100%. I can share with you 60 to 100%. For the patients who have very little, more than 10 liter oxygen, you can put the 10 liter and to the max 15 liter oxygen to the patient. You can see here, the difference is only got valve here or no valve. The valve here only. Between the tube there got valve or no valve only. See the difference? If face mask means they have no this bag only. Don't have this bag. So venturi mask is the one I say. You have to control the percentage of the oxygen going to the patient. This one just for your to sharing only lah. I mean different color carry different percentage to go to the patient. So when we talk about oxygen therapy, when you want to give oxygen to the patient, you must have something called humidifier system. Means a bottle carry of water. Why we need it? Because as I said just now, when we talk about oxygen, only oxygen directly go to patient, it will cause dryness on the nostril then you later on you will see bleeding, all those things. So this one humidifier actually to help for long-term patient who request oxygen, help to prevent the dryness, little prevent drying. So this actually water help to balance back, okay? So what is the responsibility when the patient on oxygen? What are we concerned to? What are we need to do? What we need to monitor for the patient? With all oxygen delivery system, the oxygen is when the oxygen is turned on, you make sure when your oxygen is turned on to the patient is functioning. Then before you put on the patient,